Hi there, here we are with a patient of ours that flew in today for a corrective hair surgery. He had the Artas robot machine do his procedure about a year ago. He was looking for a lower frontal hairline and to restore his temples. He did a 1700 follicular extraction Artas case, and unfortunately he was not happy with his results.
2-day procedure.
The procedure took 2 days to get him the result that he wasn't looking for. I want the camera to take a close look at the follicular extraction area. What happens is when the robot takes the follicular units out, it's punching out little areas. Each little area that it punches out, it tries to get a perfect follicular unit. What happens is unfortunately it does not get a perfect follicular unit. It destroys the follicles, and then in return leaves a scarred area void of hair. So when I do my next procedure, unfortunately it affects the amount of donor area I'm to get due to the previous punch biopsy extraction by the Artas machine. Alright, here we are. Excellent. Yeah, tuck down with this, please. That's awesome. Good. And a full turn right or left for me, please. Head up nice and straight. That's excellent. Other side, sir. Excellent. Let me just kind of lift this little area here and show this. Excellent. All right. Very good. Have a seat here, sir. All right. All right. So here we are with Casey. We did Casey's surgery about 11.5 months ago. Casey did a MaxHarvest procedure with us. Casey had another procedure with another doctor. Will you tell us a little bit about what happened with your first surgery?
Yeah, basically just like everyone else when they're looking to get their hair fixed. They go online and they start typing in hair transplant or options when I'm losing my hair, and I came up with one of the local doctors out there. Had a consultation and everything seemed legit. I was scared there was going to be a massive scar across the back of my head. So I told them that, and I think they took that as some kind of buying question, and they started gearing their entire presentation and everything toward that, and everything looked good. They showed me before and afters. It was a little bit more expensive, and they said that's pretty much painless. You're not going to have a scar, and it'll do better work because it's a robot, not a human, basically.
Okay, so the doctor was selling you the robot called the Artas.
So it was the consultant.
The consultant.
The consultant, and then
Okay.
the doctor came in. I
So
saw the
it
doctor.
was the Artas machine?
Yeah, it was the Artas.
Okay, so you went for the Artas procedure.
Mm-hmm. Correct.
Okay.
Yeah, so I literally saw the doctor for 5 minutes prior to actually being in the chair. It was devastating. It was something that I wouldn't wish on my worst enemy. It was, like, I can't even, there's no exaggerations, it's literally something out of a horror movie. And I don't know what experiences other people have had, but they literally strapped my head down to this, it looked like a massage table almost, so I could breathe. But I was strapped down, and this thing was punching me in the head for hours on end.
Wow.
And it was brutal. I could feel every single punch, and it was.
Now they used the anesthesia, right?
Yeah, but it doesn't.
It did help.
It took away the sharp pain of it actually like puncturing the skin, I guess. But it was the entire machine. The force was like shaking my head.
Oh wow.
It was literally like every shot, my head was like.
Oh, I didn't know that.
Yeah, it was brutal, and it was a 2-day procedure, which I didn't know that wasn't standard. I had no idea.
Wow.
Like most people, when they're looking into something new like this and in a field they're not familiar with, they have no idea what to expect. So, yeah, it was a 2-day thing, and I thought that was typical. I thought that was normal. So
you had to go back a second day for more anesthesia and more hole punching.
So the first day they set the sites and they did their thing, and yeah, they did the anesthesia. They gave me.
They made the holes the first day.
Correct.
And didn't put any grafts in.
Correct. Yeah.
And then they kept your grafts overnight and didn't put them in.
They didn't take the grafts until the second day. So they did the sites the first day, and we did the consultation. He mapped it all out.
They did the sites up here with the robot.
No. The sites by hand.
They did the sites the first
So the
day?
robot doesn't place, it just takes them out, extracts.
And so, okay.
So the doctor physically made the sites the first day.
Okay.
He mapped everything out,
Okay.
and then the next morning I came back, and that's when they re-numbed me, so had to go through everything again, and then they took the grafts, and then they placed the grafts. So yeah, it was brutal.
Wow, that sounds like a torture chamber.
It was the worst experience of my life. So
Wow. You know,
Yeah.
I've heard of several of these stories. Well, more than several, but I've never heard it told like that. I didn't know they did it that way. Interesting.
So
Well, this is what we see. We see a lot of patients that have had, whether it's the Artist machine or the NeoGraft, or it being done by hand where they're manually extracting follicular units from the back of the patient's head, and they're calling it the latest, greatest, and best procedure, when in fact it's not even close to that. It's basically a reinvented plug. I don't know if anyone remembers today, but what they did in the past is they were doing plugs. Same thing. They took a punch biopsy, punched a hole out of the back of your head, punched a hole out of the top of your head, and plugged it in. There's nothing different what they're doing today. It's just now a smaller punch. Now, and then they make little slits on top. So now you had a procedure with me about a year after you had your FUE.
yes.
And now you'd given up, lost hope, correct? You told me you lost hope. You didn't really think I could do anything for you.
Yeah, so basically it started from the beginning. I was still desperate. After a year after my FUE procedure,
Yeah.
I was in a worse position than I was
So
in.
you got no
previous three.
results. No results.
Zero results. Actually, my after pictures are worse than my before pictures.
Jesus.
It was really, really bad. So I was talking to Josh. I sent him my pictures and I said, listen, I'm not getting screwed again. Shoot me straight. If you can help, great. If you can't, then I'm gonna go my way and probably just shave my head bald. He called me immediately and he told me what the truth was. He basically told me everything that I'd been told and what the truth was in respect to that.
Right.
He was like, listen, he told you this, that's not true because X, Y, Z. And he proved everything. So I was like, okay, they sound like the real deal. I hung up the phone, I did hours and hours and hours of research, watched a ton of your videos. It's really weird that I'm in this seat now, making one. But I watched almost every single video I could find, did more and more research, talked to Josh multiple times, ended up talking to you, which was, it blew my mind. Because I didn't talk to the doctor like really prior to my procedure.
Right.
And you were like, hey, let's FaceTime because I'm not from Florida. I flew here actually this morning for my second one. But yeah, after talking to you guys, I felt very, very comfortable. I came here and obviously I was very reluctant and I was hesitant and you answered all my questions and I said, I'll recap what I told you earlier. I said, if you can't fix me on this one, I'm done. Like, I'm gonna shave my head, I'm gonna be bald for the rest of my life. And I came to grips with that and I was hopeful that wasn't the case, and thank God it's not. But I was ready.
Awesome.
I was just done. I didn't want to be taken again.
Well, I'm glad we restored your faith in the process. Now, when you came in the day of your procedure, you had a shaved head, and you had thought you went in for a scarless procedure, but what you had were polka dot holes all over the back of your head.
Yes.
Did they tell you that you were going to get that?
No. Scarless to me means no scar, as it should. In fact, what happened was I had hundreds and hundreds of scars. They were just very small, but when your head is shaved down to, say, like a 1
Right.
or bald, you can see them all. It's just the polka dots all over the back of your head. So, yes, I'm the mystery patient from last time. Now I'm revealing my results because...
You saw the back of his head on
Yeah.
a video. He didn't want his face to be shown, where we showed all the little punch biopsy holes from the previous procedure. What we hear all the time is patients say, well, I'm really afraid of that big scar. And so I'm afraid of the big scar, but what they don't realize, if it's done right, you shouldn't have a big scar.
Right.
Then they're saying, well, so I'm just going to get the FUE, so that way, if the procedure goes bad, I can shave my head. Well, that's exactly how you don't go about getting a hair transplant. You're getting a hair transplant so you don't have to shave your head. And what they're neglecting to tell the patients is that when you do shave your head, you're going to have all these little holes. I mean, there are some patients where you may or may not be able to see them, but what we're seeing is the majority of the patients, when they shave their head, it looks worse than a linear line. And so I tell my patients all the time, don't be sold on a scarless procedure. There's no such thing. There's no way you can puncture the skin and not have some form of a scar formation. It's just not possible. So they're being misled They're misleading the consumers, the patients, and we see it constantly. And the majority of what we're doing is corrective hair surgery here.
Right. There's no results. So even if you go through the whole FUE, which sometimes it's more expensive, in my case it was, than the other option, then you're done and you have no results. So then what's your next move? You're going to go do it again? No. You need real results.
Right.
So I wanted to make sure that before I showed my face and before I talked to the camera that I had real results so I could put my name behind it and condone what's going on here. And I fully support it, obviously, which is why I'm back.
Awesome.
But that was my reason behind hiding my identity originally.
Okay, very cool. Okay, so let's show what we did. We did a MaxHarvest hair transplant procedure. We went through and we recreated the hairline in case you wanted his temples built out to reframe the face. And this is him holding his own hair up. Came out great. This is one pass. This is all done by the tiny little micrographs all the way around. Today what we're going to be doing is obviously just kind of filling in the dots. We had a big area to contend with. We brought his, when you see his before pictures, you'll see we brought it down quite a bit. I mean, we really made a monster change for him, which we'll show you with the befores.
I basically had a V. You see it almost all the time. You see it all the time on guys all over the place. They have a V-shaped little puffball here, and that's exactly what I had. I had to pull this to the side to try to cover it, and then bring this down, and I could never style my hair.
Creative combing.
Yeah, wore hats and beanies every single day. So
I understand, man.
Yeah.
Well, I'm glad you're happy. Tell me, how was the process with the procedure that we did for you? How was your day there? How did everything go? And compare that to your previous procedure.
Absolutely. So it was completely different, the exact opposite. So when I first talked to you guys, that was the initial difference. I mean, I talked to Josh multiple times. I talked to you, which was, it blew my mind because I didn't think I was going to get to talk to the doctor until I was in the chair. So that was great. I was 22 at the time, my first one, and I flew out here. I don't live in Florida like I mentioned earlier. I flew out here, talked to Josh every step of the way. He came and picked me up, dropped me at the office. We walked through everything. You guys really gave me your full attention. You had the whole team come in here. I met everyone, sat and talked with you. There's no rush like we're doing today. We're just kind of hanging out. We caught up for a little bit, and when I was in the chair, I had no idea that the strip was even taken. I think I asked you, when are you starting the strip? And you said it's already done, which that's if you're fearful of the pain, that should be a great indicator of what you actually feel. Nothing. At the end, I actually fell asleep. I was super comfortable. I fell asleep watching a movie. Yeah. Great experience. I was eating snacks, drinking Gatorade, and then when I woke up, I asked if I could go pee, and you said just a minute. I said okay. So I waited a minute. You said all done. I had no idea. I thought we were at the beginning stages. Yeah. We were all done before I even woke up. So wow. It was an incredible experience. You guys made sure I was all cool after. We hung out after. We talked for a little bit, and then I was on my way. Josh called me, I believe, the next day, and then you called me the day after, and made sure it was all cool, and that's pretty much it. It was the exact opposite of my first procedure.
Wow, awesome. I'm so glad you had a great experience.
That's why I'm back.
Awesome, man, awesome. All right, let me show off the work here. So I'm just going to kind of show what we did here. So it's basically just completely restored, entire hairline all the way around, built out the temples, so everyone wants to see it with the comb. So it came out great, man. Freaking awesome. And let me just kind of show the suture line. This is my first time seeing the suture line. I'm seeing it at the same time as the camera. So let's take a look at how this healed. So, can you see this, Josh? Let me get a pointer for you, buddy. Okay, so suture line. Right here. You see this? So if you can see that. Came out awesome. So this is a suture line, but now you can start to see these little holes. That's from where he did the FUE. See the little holes? So this is what everyone's freaked out about, is this line in comparison to these holes. I mean, it's just crazy how that works. So if this line bothers Casey, we could always put hairs in and graft it if need be the case once we get the hair. So there's no point in putting somebody through the process of 2 days of a procedure for no results. It makes zero. Meanwhile, this. Did you see your suture line? It's
I
absolutely.
haven't seen it.
You want to see it? It's absolutely perfect, man. Check it out.
So just for
So,
camera's sake, this is a number 4. People are always asking me like, how short can you shave your head?
So-
This is a 4.
so,
Wait, how do I see it?
so.
Oh, there we go.
Okay, so let's check it out. That's your suture line.
Wow.
That's it. So all the way around. It's just a tiny, see that little trace line?
Yeah.
That's it. So you healed absolutely perfect. So here it is the whole way around. See that little line there?
Mm-hmm.
So you can see the dots more than you can see the line.
Yeah.
Isn't that crazy? Look at it. So here are your dots all over. And then here's the line.
Yeah, it's insanity.
So crazy, huh?
Yeah. Well, good thing you can take out some of those dots, right?
Well, if need be the case, we'll take some more today to put more hair up there, and then if they really bothered you, we could always, if something stood out,
Yeah.
graft it. But you're never shaving your head.
Yeah.
Doesn't
That's
make
why I'm
it-
doing all this.
you're
I don't have to shave my head.
So who cares? It doesn't even matter. That's why I tell the guys. They get so caught up in the suture line, and they miss the point of what the result
Yeah.
is, and that's what matters, is getting a result. We're going through this so you don't have to shave your head.
Yeah.
Is there anything you would say to someone who's thinking about doing a procedure to give them? I'm not saying everyone should go to me, but do you have advice for someone searching?
Research. Do a ton of research. That's huge. Ask the hard questions. Ask the questions you really want to know. Call them. If something sounds too good to be true, then it most likely is. Before and afters, ask how many procedures it was. That's a huge one as well. They could be showing you before and after, and it could be 10 procedures, and you have no idea. Talk to people. Don't just do videos online or whatever that might be. Don't just email. If you talk to someone, it's a real person, you get a good feeling from them, then ask the right questions, and then maybe schedule a consult in person and go about it the right way. Also, sooner rather than later, because the first doctor never put me on Propecia, never put me on the preventative treatments, so that could be attributed to why my afters were worse than my befores from my first procedure with the other doctor. So
A lot of doctors won't put their patients on it because they want them to come back more.
yeah,
So they have a hidden agenda as to why they won't guide the patients to prevention, because then they need more surgeries.
oh, and a huge one, last one, don't pay by the graft. Josh broke the entire thing down for me, and he's like, listen, the graft system is basically a scam. The doctors can break a graft, one graft, into 5 grafts, and now you're paying 5 times as much for the same amount of hair. That was one of the huge, I guess, motivating factors to coming in here, because once I heard that, it made so much sense. And when you're in a desperate state, losing your hair, it's devastating. Mentally, it destroys you, especially being 20. I was 20,
Yeah,
I
you
was
should.
probably 19 when I first started it. My first procedure was when I was 20. Devastating. All my friends have great hair. You don't want to talk to anyone about it. You don't. Your ego gets into it, you're emotional, whatever it might be, whatever you're manly enough to admit, I guess. Ask the questions, make the move. It's something that's important. Hair is important regardless of what people tell you. It's important. People look at it. Just like if you walk into a bar and you see a group of girls and there's 3 girls with great hair and there's 3 girls that have big patches. I mean, which ones are you going to go and talk to? Which ones are you more attracted to? It's the same thing for guys. I mean, just because it's more prevalent in guys that we lose our hair, it doesn't mean that it's not more attractive if someone has a full head of hair. It's not everything, but it's important to me. If something's important to you, take care of it. If it's not important to you, then you probably wouldn't even be watching this video and you probably already have a bald head.
That's
So
exactly right.
I guess it was important to me, so if it's important to you, go do your research and spend some time on it, because this is something that it's going to affect you for the rest of your life. So
Well, you learned a lot, man. You learned a lot. Josh, is there anything you want to add to this before we?
No, Casey did a great job. He's very thorough,
All right.
very informative.
Well, I appreciate you coming forward and speaking to the camera.
no, I appreciate you saving my hair.
I'm so happy for you, brother.
Thank you.
It makes my freaking day, man. You have no idea.
It makes my life.
Especially when someone comes in the way you do, which I see all the time. I mean, this is not a new situation for me, where they just lost all hope. They're discouraged. I mean, the majority of what we do is corrective surgery. That's about 75% of our business. So we're fixing these cases, fixing all these cases from all around the world.
So
I'm
I
happy
guess
to get you
one
back
more
in
thing I
business.
could say about that. The reason why I chose the first doctor over you is because you don't think when you're 20 years old, I'm going to fly across the country and I'm going to go see this doctor who I've never met. I think that's a big deterrent for people, and it's really not that difficult. Like both of you offered me a travel credit and basically covered all my travel expenses. I stayed in a hotel down the street, you provided transportation or set me up with something where that would take care of the transportation to and from, and it was in and out. And it was a way better experience. Actually, I could do all of this, including the flying, faster than my 2-day procedure.
Wow.
So that shouldn't be a deterrent. Location shouldn't be. This is something that's going to last you for the rest of your life. It's very important. So do it right, regardless of where the doctor is.
You made a great point.
So I guess that's the last point I have.
Wow.
Thank you again.
Hey man, congratulations. Awesome.